Doctors are learning more and more each day about the long-term effects of COVID and how they can have, what they can have on your body, from young people to those who are older. And joining us to talk about some of these health effects and what we can do is Dr. Abha. It's an internal medicine specialist. Good morning. Thanks for being here.
Good morning.
So let's talk about this post-COVID type of thing that people are going through, especially they're called long haulers.
Correct.
Talk exactly, what is that exactly?
So, there is no universally accepted term. Long haulers, chronic COVID, and post-acute COVID will be the names that you will hear at large. And that refers to the lingering symptoms of COVID-19 that trespass the initial 2 weeks of convalescence. So just when patients and sufferers think it's over, I can come out of quarantine, they find themselves with lingering symptoms for which there's little to no explanation initially.
Now, doctor, is this something that only happens in those who have tested positive, or can be someone who hasn't really experienced that?
That's such a great question. And sadly, there are those with minimal to no symptoms who are coming to me with symptoms like headache, hair loss, lack of balance, depression. There's no organ system that is spared. Head to toe, it becomes like a syndrome where COVID-19 can essentially attack any organ, any blood vessel, and leave patients with lingering symptoms. Now, not everybody will suffer to that extent. We're seeing anywhere from 18% to unfortunately up to 80% of COVID-19 sufferers coming back with more chronic symptoms.
In what you have seen, is there any way that this is going to come to an end? As far as those long haulers, will they ultimately get rid of these lingering symptoms?
It's an excellent question, and I think we have every expectation that with time, it's the eventual healer. Patients will come out whole again. But Mr. Avery, I often think of people suffering concussions, and it seems like such an interminable amount of time before they feel back to themselves. I liken the post-COVID state to some of that, where there is uncertainty about the duration of symptoms, but a full expectation of recovery with time.
Any recommendation very quickly for what folks should be doing to kind of help with these long haul symptoms?
To begin with, as we embark on the holiday session, I can't impress upon people enough. It's not a one and done, just get COVID and get it over with. Prevention is still the cure. And so we want for the lot of Americans and people worldwide not to acquire COVID by remaining within your pods and in your nucleus. Please refrain from traveling to heavily infested areas, as it were. And do not believe that being young or within that safer age group that you will leave unscathed. Please practice prevention. Frederick Douglass once said, if there is no struggle, there is no progress. This is our collective struggle. And even though we all want to gather during the holidays, the goal is for us all to come out healthy and well.
Very good. Dr. Abha, thanks for being with us. Great to see you.
It's my pleasure.
All right, it is 7:33 and still ahead.